Coach, and tonight I want to address a very, very important topic. Um, we want to talk about no jab, no job. I know that everybody saw the president's address on, I think that was Thursday, where he addressed it all federal workers, people who had federal contracts, um, that he had mandated, them to get the jab, as well as employers that have 100 or more employees were also required to, for the mandate for their employees. Um, so as and then also I want to um, get you guys thoughts, if you're an employee, and if you have a different opinion, to what was talked about on Thursday. I would love to hear your comments, and your feedback, because we do have people that still feel as though that they don't want to go in that direction, and there is, everybody's entitled, to their opinion. So it would be good to hear, both sides here. And also, I am going to be talking about, later on in the video, about becoming independent. Because when we talk about no jab, no job, you definitely need to think about becoming independent, having your own business. So I'm going to talk about some resources at the end of the video, but I also want to capture a few clips on what the president had to say. So give me a minute when I flip the screen so I can get you there. Let's see. Let's move this up here. Flip the screen.
That the Department of Labor is developing an emergency rule to require all employers with 100 or more employees that together employ over 80 million workers to ensure their workforces are fully vaccinated or show a negative test at least once a week. Some of the biggest companies are already requiring this. United Airlines, Disney, Tyson's Food, and even Fox News. The bottom line, we're going to protect vaccinated workers from unvaccinated coworkers. We're going to reduce the spread of COVID-19 by increasing the share of the workforce that is vaccinated in businesses all across America. My plan will extend the vaccination requirements that I previously issued in the healthcare field. Already, I've announced we'll be requiring vaccinations of all nursing home workers who treat patients on Medicare and Medicaid because I have that federal authority. Tonight, I'm using that same authority to expand that to cover those who work in hospitals, home health care facilities, or other medical facilities. A total of 17 million healthcare workers. If you're seeking care at a health facility, you should be able to know that the people treating you are vaccinated. Simple, straightforward, period. Next, I will sign an executive order that will now require all executive branch federal employees to be vaccinated. All. I've signed another executive order that will require federal contractors to do the same. If you want to work with the federal government and do business with us, get vaccinated. If you want to do business with the federal government, vaccinate your workforce. And tonight, I'm removing one of the last remaining obstacles that make it difficult for you to get vaccinated. The Department of Labor will require employers with 100 or more workers to give those workers paid time off to get vaccinated. No one should lose pay in order to get vaccinated or take a loved one to get vaccinated. Today, in total, the vaccine requirements in my plan will affect about 100 million Americans, 2/3 of all workers. And for other sectors,
Okay.
I issue this appeal.
I just want you guys to see that clip, and I would definitely love to get your feedback on, what the president addressed on the past couple of days. Now getting back to starting your business, like I said, if you fit in that category, federal worker, contractor, or if your employer has 100 or more, that is definitely going to be targeting you. So my question to you: what is your plan? Do you have a business? Do you have your own business? Or I'm going to say to you, if you feel different about the jab, then you're going to have to get your own business. That is just simple as that. You're not going to be able to work for anyone if you don't basically have that card. So what are your plans? What are you trying to do? I have some alternative ideas to help you, and basically I am a visual brand startup coach. I do help individuals start new companies. So if you're interested in getting a business started, and you know that you fit in those categories and you feel different, then I would be more than glad to help you get your business up and going and started. So you basically would just have to reach out to me in the comment section, and then, or I'm not sure if there's an inbox on here, but if you reach out in the comment section, then I would just have to get your email address, and then I can move forward in getting you with the business startup coaching program. It's so, like I said, that's your only way out, is to get your business started if you feel different about what was just discussed. Now, I have 2 other trainings for people that are self-starters. You can take my course called How to Start a Business Like a Boss. That is only $87 to start that training. Excuse me. And the other training is my business plan mentoring course. That is also going to be on the link in the description section. So you're going to have 2 courses: How to Start a Business Like a Boss, and my business plan mentoring online course. So you're going to have 2 options. So if you already started your business and you need to grow it, you would need to go with the business plan. And if you haven't started a business, you need to go with both of those trainings. So like I said, How to Start a Business Like a Boss is $87. The business plan mentoring is a 4 to 6 week class. Online. It's on an online platform, and that is only $175. $175 for that. So I'm putting this out here now because I'm saying to you guys, if you feel different about what was discussed this evening, then you definitely need to get moving. Time is of the essence. So you need to get the business started before the year is out. You can't, like I'm just saying, you can't mess around and play around, because there is a deadline on you. Is going to be deadlines put in front of you. And I'm thinking October is really that month, because I've been, other people have came to me and they had another deadline from their job. It was October. So that October range is going to be where they are going to be letting people go who haven't, made that decision. And like I said, if you have not, made any plans, you need to start making plans now if you feel different about what was required. That's basically all I'm going to say, because hey, it's not your company, so you can't do, it's nothing you can do about it. So either you're going to comply to what they say, or you're going to either get your own business going. That's the two choices you had. So other than that, I'm gonna put the posted links in the description sections for you once the video is finished, so you can check in there and see, to access those trainings. Also, I want to talk about the next part. I want to talk about is exemptions. So there are exemptions for those that have real medical issues that may interfere, that the jab may interfere with their health condition. And then we also have a religious exemption, and it has to be, if it's a religious belief, stance, then you can get an exemption. So basically, I would just tell you, if you fit in any of those exemption categories, I would just recommend that you do your research, thoroughly do your research. Talk to your doctor if you're looking to get a medical exemption. Know your rights, know your condition good enough to know that, hey, this could interfere with my condition. So you need to do your research, and I would even write some things out for myself. Even though you might go to your doctor, you just say, hey, this is what I researched too, doctor, and this is what this is the information I had that did say. And you want to definitely cite where you got the information, so you can, of course, your doctor probably most likely would know, but I think you still should be educated on what your health condition is and what can interfere with that health condition. So do your due diligence with that. And as far as the religious exemption, I've been seeing that all across the news. It has been different churches, different organizations that have been given their congregation exemptions. Because they have a different belief system. They don't believe in putting certain things, medicines, into their bodies and different things such as that. So like I said, and everybody's entitled to believe what they want to believe. Is their body, and that's just my opinion. People are going to have their own opinion on how they feel about the situation, and everybody is at different places right now, and some people feel, like I said, they just feel different. And so basically, and it's not to make nobody feel bad. It's not to make someone feel like they or shouldn't be a part of because they feel a certain way. So it's just a freedom of choice. So basically, so you wanted, like I said, in terms of exemptions, they are out there. You can get exemptions, but like I said, do your research. And I guess if you're part of any organization, church or religion, you might want to reach out, and see what, your religious or leader or whatever the case is can guide you in that direction. So I just wanted to, give you that information because, like I said, it is out there. So, not to say that everybody will be entitled to religion exemption or medical, and so it's just, I guess I would say, Pacific people that can claim that. But on that note, that's pretty much it. And so definitely make sure I want to hear your comments. I want to hear, your feedback, how you feel about the exemptions, and how you feel about what the president had went over here past Thursday. I'm actually coming on now to do my live. I was supposed to do it that same day, but I didn't get a chance to get to it. So I'm doing it now. So don't forget, guys, to make sure you like the video. You want to like the video. You want to like that video, hit that like button over here. And then over here, you're going to subscribe a little bit below. You're going to subscribe to the channel. And I will be seeing you very, very soon. Everybody have an awesome, awesome, awesome evening.